G'day, Mick Green from Total Performance Centre here. Just going to do a bit of a shoulder treatment workup today. If you don't know the history of my shoulder, which why would you? I had shoulder surgery a couple of years back now. I had a chromioplasty. I had long-headed bicep cut, reattached in the bicipital groove. I had labral surgery with 4 pins, or not pins, stitches to hold the labrum back down, and I had about 18 to 20 years of arthritic damage from early shoulder injuries to fix. So I'm going to show you at the moment what's going on with my shoulders. As you can see, this shoulder sits a little bit low, and if I show you the good side first, I do have a bit of an anterior rotation. You can see the head comes forward a little bit, but then as I come through on the other side, you can really see that head coming through on there. Okay, and that's just me holding there. That's just naturally quite comfortable. Okay, so what we're going to start with today, instead of just thinking muscles, we're actually going to go nerves. One of the leading issues through here is the long thoracic nerve that runs down under here. So what we're going to do today is we're actually going to do a little bit of dynamic cupping. So I'm going to use one of these little vacuum seal cups here, slap a bit of the old sorbeline cream just through on here, run it down, and what I'm also going to hit is the anterior portion of the lat on this as well, because that really gets affected. So we're going to pop a little bit of cream on there, get it nice and lubed up, chuck the cup on. And what we're going to do, get in and around that zone, and what we're going to try and do is open up and get any superficial nerve adhesions, and start to see if you can open up that nerve again. So, and you just hold it there, start doing some dynamic rotations. You can really feel that pulling through into that position. So by the feel of it, I've got something going on in there. Open up, change the position a little bit, come down. Okay, go a little bit higher, see if I can get up into some of those high, really high serratus fibres and in onto that nerve. And then just work on really trying to draw that scapula around the rib cage. Okay. Once I've done that, I'm going to put a bit of traction on it, and I'm just going to run up and down where that nerve sort of sits. I see it reddening up quite a bit through there. A lot of pressure through that cup. It's just really, that's superficial area through there is quite bound up. And then just starting to come out onto the the anterior fibers of the lat, and really feel that pulling, and it's quite unpleasant. Just working through that tissue there, and that's a quick little workout through there. And just off that position there, it's sort of come up a little bit. And if we look side on, and so I can actually feel that's loosened up quite a lot through there already. Okay, and then the range of motion, just opening up those fascial lines through there, and then also, as we said earlier on, starting to work, trying to get any adhesions up on that long thoracic nerve up in here, and allow that to start to loosen up. Then the next part we're going to do is up through here, in that sort of looking that front line in on that deltoid and the brachial plexus that comes underneath the pec through there. We're not going to be able to affect that deep nerve there, but there's a lot of nerves that run through that superficial area coming onto the skin and that. So we're going to just Put a little bit of traction on it again. Just change the location, see if you can't affect it. Different areas, there can be adhesions or sticking points pretty much anywhere. Range of motion starting to get there, and you can see after post-surgery as well, you can see quite a bit of atrophy through that posterior deltoid capsule there, the complex. You can see there when I try and flex it, it's coming up, but compared to the anterior portion of the deltoid, it is quite wasted through there. So that's, for me, that's a really important part there. I've got to concentrate on building up some posterior deltoid function, and with everyone, we've got to be working on that rhomboid and that lower trap to be able to draw those shoulder blades back to actually get the range of motion and open that up. Alright, cool. So that's a quick little treatment tip. It's something we offer here at Total Performance Centre to help with shoulder capsule and range of motion. Really good for swimmers, pretty much anyone really, desk workers, those sorts of things, to be able to loosen that up and to be able to get those the arm above the head without flaring the ribs too much. It's a really important little trick. All right, have a good day. This is Mick out. Have a great day.